Hey everybody, Buck Buckminster here today with Dynamic Chiropractic and Rehab and Dr. Paul Constante. Dr. Paul, really some good things going on here from what I'm hearing. A lot of excitement all over town about what you guys are doing to help the folks in this area. Tell me a little bit about what makes you special here.
What makes us special is we've incorporated the best of physical rehab with chiropractic, and what it is we have a team approach to wellness. So how it comes in our clinic is you'll get checked out by a doctor, one of our doctors, and then we'll also do a thorough orthopedic and neurological exam. We take some x-rays, then based on the films we actually design a rehab protocol based on your body. So we design our rehab from what we see on the inside of the body, and then we look at the body based in white tissue, which is ligaments and tendons, red tissue which is muscles, and then we stretch and strengthen your muscles and tendons. Then we use a device called spinal decompression, which actually pulls the damaged discs apart and helps them heal. And then we do chiropractic manipulation and also craniopathy, which is working on people's skull bones. We do a lot of soft tissue work. We have many different instruments, so it's not just your standard manipulation. We actually can use instruments that are very gentle, that might tap your body that hard, or we might go a little more aggressive depending on what your body and your nervous system wants.
So very much a personalized, customized approach for every person's body that would come in here, because I guess every injury or every concern is a little different.
Everybody's concern is different. We're big on diagnostic testing too. We want to find out exactly what your problem is. So if we need to order an MRI, if we need to get you to a neurosurgeon or to a neurologist or an orthopedic surgeon or to another facility, we have a certain timeline we work with that someone has to be better by then if they're following their care plan, and if they're not, we actually refer you out for the next level of care, because we want results whether we fix you or not. The most important thing is that patients get well.
Okay, well I know we're going to go for a tour of the facility in just a second, but tell me a little bit more about the care. You mentioned MRI a minute ago. Now are x-rays something that you can do in-house?
Yeah, we have in-house digital x-rays.
Okay.
We also have a good relationship with a couple different MRI centers.
Okay.
We have an MD and a neurosurgeon on staff.
Okay.
So that the patients can also have medical care inside the office.
Very nice.
And also through the medical department we do medical weight loss.
Well, tell me more about that, because I've heard a lot about your approach to weight loss. I understand it's very effective, and again, it's personalized and customized approach.
Our approach to weight loss is you would sit down with the nurse or the MD, and basically they would do a consultation history, and then what we're doing is something called the HCG diet.
Okay.
HCG is a hormone that your body secretes from your hypothalamus, which is the center of your brain. That talks to the pituitary gland, which talks to the thyroid, which talks to the adrenal glands, and then it talks to your sex organs. And what happens when people get burned out or stressed out or toxic, that communication cycle breaks down in the body, and the body, no matter what they do, they can't lose weight. So when this hormone's present, what it is we cut the patient's calories back, the hormone is present, and then now the body will go to the abnormal fat reserves. There's people who have sections of their body, no matter how much they exercise or diet, they can't get at. Well, the body has this hormone present, so then it goes right at those, and the average patient, almost every patient, loses 15 to 30 pounds in 30 days.
Wow. Extraordinary results.
Extraordinary.
Wonderful.
Go ahead.
Well, I was going to say, when you're ready, let's go take a look at the facility.
Okay, let's go.
I've enjoyed this time with you so far.
Hey, thanks for coming in.
Thank you very much.
All right.
Back here with Dr. Paul Constante. Paul, tell us a little bit about your facility here. I know you have it broken down and set up in sections, and I know you have very specific treatments, if you will, going on in each section. So walk us through, tell us what you got here.
Over here is our spinal decompression for cervical and low back disc conditions, lumbar degeneration. Over here we actually have some forms of pain management, which is interferential therapy, muscle stim, ultrasound, and laser therapy. We do have in-house bone density testing. We make our own orthotics over here. Here's our warm-up section, which helps warm up the discs and neck tissues. We also have over here vibration platforms. We actually use spinal or whole body vibration to help loosen up the tissues in the body to take the rehab better. Over here is our synergy system for strengthening elbows, shoulders, low backs, knees, and ankles. We have wobble platforms for working with balance. Come in and get a nice 15-minute water massage that really relaxes their tissues, works with pain control, and you just feel great. It's just a very relaxing experience. We really focus on getting your nervous system working at its optimum potential. So we look for different imbalances in the body, and we strengthen the imbalances, relax the body, and help energy flow so the body will actually heal itself. We have our own digital x-ray system so that when a patient gets a set of pictures with us, if they ever need their films, we just put the films right on a disc. Here's our massage therapy department where we actually have 2 great massage therapists who work here, and it's to help the ligaments and tendons and muscles relax to further help control their posture. The whole facility is based on straightening out someone's posture. As someone ages, their posture begins to go, and if you can really strengthen a body, and adjust the nervous system, the body will really have a great potential to heal.